Hello.
Hi, good evening, doctor. How are
Good
you?
evening. I'm good. I'm good.
Okay. Okay, good evening, everybody. Welcome to today's live session of TIP Media. So, today we are going to talk about the correlation between high cholesterol and diabetes. And today we have Dr. Manideepa Majumdar with us, and we'll be talking about high cholesterol and diabetes. So, Dr. Majumdar is an experienced cardiologist and currently is working as an assistant professor at Sri Jayadeva Institute of Cardiovascular Sciences. Perfect. Welcome to the live session, doctor.
Thank you so much. Thank you so much for this opportunity to share a few words of wisdom with you guys. So, I will start with the relationship of diabetes and cholesterol. Basically, it runs both ways. If a person has high cholesterol, that person has an increased chances of developing diabetes, as well as a person who has been diagnosed with diabetes will have a higher chances of having abnormal cholesterol levels. So, why is it so important to us right now? Because now, in this urban population and all, especially in growing countries like India, we are having an epidemic of metabolic syndrome. So, what is metabolic syndrome? It is nothing but a constellation, a package of things, different diseases which happen together, like obesity, increased weight, increased waist circumferences, lack of physical activity, high cholesterol, high blood sugar, high blood pressure. So why is it so problematic? Because this metabolic syndrome and all its component usually leads to heart attack and stroke, uh, speaking very plainly, which is also called as the cardiovascular risk. So, the commonest cause of death worldwide, including India, is heart attack or stroke. So, and the main reasons for these events are high cholesterol, high blood sugar, high blood pressure, and a very unhealthy lifestyle. So if a person who is found to have a high cholesterol, there are two, three ways how he can have chances of having diabetes in the near future. Firstly, these high cholesterols break down into small particles. They are called free fatty acids. What they do, they can be good things. They are used as energy by the muscle, by the liver, but they can also affect an organ called the pancreas. Now, this pancreas secretes a hormone called insulin, the deficiency of which causes our diabetes. Here I'm talking about the type 2 diabetes. Type 1 diabetes is a genetic condition and is much, much rarer than type 2 diabetes. India, being a diabetic capital of the world right now, has the largest amount of diabetic patients. And what these fatty acids do are harm the beta cells of pancreas and causes decrease, loss in the insulin secretion. And thus, we cannot fight the high blood sugar. What insulin helps us in bringing down our blood sugar. So, if there is a lack of insulin, there is a high blood sugar, and thus the person becomes more prone to develop diabetes. The other reasons are being these free fatty acids get into the muscles and liver, the places which use the glucose or blood glucose, and causes an insulin resistance. Like there are insulin present in the blood, but these tissues are not responsive to it. So the tissues are not being able to use glucose even when insulin is present. So that will also result in a high blood glucose and cause diabetes. The third thing is obesity. High cholesterol will lead to obesity, increase in weight, and especially increase in your belly fat. Belly fat is much worse than the fat in your arms and legs because it acts as an organ itself. It secretes substances like hormones and adipokines, which causes huge damage around many organs and cells of the body. It increases the inflammation, it damages our pancreas, it causes widespread damage to different parts of blood vessels, which and make the blood thicker. So it causes plaque formation in your heart's arteries and your brain's arteries. So all these things lead to more chances of heart attack and stroke. And also these hormones will change the way we eat, change the way we process our food, leading to increased blood sugar again. So there are three, four different kinds of ways how high cholesterol may cause diabetes and increase blood sugar.
Okay, so particular questions. We also have a question in the comments. Can
Yes.
that also cause heart defects?
Can high cholesterol, or sorry, I didn't get you.
also cause heart effects?
Can diabetes?
Yes, ma'am.
Yeah,
Can diabetes also cause heart?
yes, yes. Yes, actually, diabetes can cause various kind of heart disease. The commonest being the one I was just explaining. It can cause blockages in different arteries of the heart, and when these arteries or blood vessels in the heart get clogged, so the heart does not get adequate blood to pump. To act as a pump, it needs continuous supply of glucose and oxygen. So if we block the pipes, then it will not get those nutrients and it will start failing. And if the vessels, these blood vessels, get completely occluded, people will have a heart attack. And if they are not completely occluded, people may still have heart pain, which is also called angina, while working or during strenuous exercises and all. Secondly, diabetes affects the heart muscles as well. So over a long period of time, if the diabetes is uncontrolled, as a whole, the heart muscles ability to pump will decrease. It's called diabetic cardiomyopathy. So it can have affect the heart muscle as well as it can block the arteries as well. So we find these heart blocks much more in diabetic patients than in normal population.
Okay. Yeah. Question: how to keep weight in check so as not to have increased chances of high cholesterol?
So yes, so dietary, firstly, weight is based on two things. One is your diet, one is your physical activity. So diet, it is not only reducing the energy intake you take. Firstly, we have to make it into a balanced diet. It is best if a person is obese or overweight to visit a nutritionist or a dietitian who can individualize the diet plan for a person. But for day-to-day practice, we always advise people to have high nuts intake, taking more sea fishes, which are rich in omega-3 fatty acids. These nuts, omega-3 fatty acids, and high fiber diet, which is more and more green leafy vegetables and unpolished grains. They will help to reduce the cholesterol by all. Firstly, by limiting the amount of cholesterol we are taking. Secondly, processing the cholesterol that is also present in our body. Some of the diets which are famous to reduce weight are this Mediterranean diet or the DASH diet, which is advised for hypertension. But it is very important to note that patients who are diabetic or hypercholesterolemia, I mean, who has high cholesterol, they are not advised to go on this very rigorous keto diets and long fasting diets and all those things without a supervision of a doctor or a nutritionist. Okay, so this is the diet part, which comprises around two-thirds uh, weightage when you're trying to lose weight, and the one-third weightage is your physical activity. The minimum advised physical activity is 30 minutes per day for 5 days a week, which means 150 minutes per week is the bare minimum to maintain normal physical activity by a adult human being, and cardiac like cardio kind of exercises or isotonic exercises, which are running, swimming, this kind of exercises are preferred better, though isometric exercises are also useful for muscle building and especially for elderly persons who are more lean and thin, who are losing weight.
Okay, so nowadays, due to various lifestyle and professional choices, right, a lot of people are under a lot of stress. So, do you think stress plays a role in the development of diabetes of individuals with high?
Yes, of course. There is a term called epigenetics, uh, which is a little difficult concept to understand, but this is if a parent has certain diseases because of their lifestyle choices, there is propensity for these traits to get into their genomes, like get into the gene that they transfer to their offspring. So this is called epigenetics, our phenotypic behavior, lifestyle behavior, generating or making new genetic changes that are passed on to the next generation. So if we are having a bad lifestyle, we are having lifestyle diseases like diabetes and metabolic syndrome, our children are more prone to have that. It is so much so that almost 90% of type 2 diabetes, which is of multifactorial origin, is also familial. If some parents nowadays in India has diabetes, their children are very highly 3 to 5 times more likely to have diabetes than a person whose parents were not diabetic. There are even tougher concepts like thrifty phenotype. So we South Asians, which includes Indians, Pakistanis, Bangladeshis, we are at a very high risk of developing diabetes, and that too around 10 to 15 years earlier than our Western counterparts, irrespective of our weight, irrespective of any of our lifestyle changes. This has happened due to very many decades of malnutrition of the Indian woman, which has made their fetuses, their next progeny, more prone to develop fight and flight responses so that their blood sugar stays high in the face of starvation. But what has happened over the decade, now Indians don't starve, but we still have that genetic makeup in our genes to keep our blood sugars high, to fight in case we have a starvation, to fight that starvation period. So in that way, it is called a thrifty phenotype. This term was coined by a UK physician and has been very commonly used among diabetologists. So yes, our habits and our lifestyle will affect our next progenies and generations as well.
Perfect. So before moving ahead, I would just like you and our audience to be informed about our diabetes community, which we have on WhatsApp. And in case if anybody of you is looking for any, to connect with people who are also interested in getting the news about diabetes and everything, right? So you can just comment down below the time in, and we'll definitely make sure that we send you a link. Also, and you can find the link in our bio as well. Okay. Moving ahead, doctor, are there any demographic or genetic factors that may increase the likelihood of developing diabetes in people with high cholesterol levels?
Surely, like just the thing I explained, there are actually multiple genes, more than 100 kinds of genes, which increases the propensity to have diabetes. Firstly, our race. As South Asians, we are more likely to develop diabetes. Our genes have more tendency, but there are no specific genes that we can screen and tell a person specifically that you have this particular gene. It's not a genetic disease per se, like it's not a monogenetic disease. It's not dependent on a single or two genes or three genes. It's dependent on hundreds of genes, but there are very many genetic factors on which increases the chances of having diabetes. And demographic, we have seen in the last few decades that urban people and obese, this because of our lifestyle differences, are more likely to suffer from diabetes. This is because of our worse eating habits, because of our stress, because of our sedentary lifestyle. So we don't go out to the fields to work. We sit at a chair and staring at a laptop all our days, and we don't move, and we get overweight, and we feast on junk food, and thus obviously Indian urbans have a more chances of developing diabetes, and Indians in general have more chances of developing diabetes compared to the other counterparts like Caucasian or Black population.
Uh, uh, Tell us about diet and lifestyle changes that may, reduce the risk of diabetes.
Okay, so these are almost same as everything that is advised for hypertensive and high cholesterol patients as well. Firstly, diabetic diet. One has to follow diabetic diet from the day they're diagnosed with diabetes. There is no exception. There are no cheat days, because what cheat days do is increase our blood glucose suddenly so much that that high blood glucose will go and affect our eyes, our brains, our kidneys. The excursion of blood glucose, that is the highs and lows of blood glucose, the more extreme they are, the more harmful it is for our organs. So diabetic diet is the first thing that is very important, and everybody should individualize their diet according to their lifestyle or preferences. Like if you're a vegetarian, non-vegetarian, you're a Jain, you're a North Indian, South Indian, it will depend on your food habits, of course, but it has to be tailored by a doctor or a nutritionist. Secondly is physical activity. Basic 150 minutes of physical activity per week is advised for everyone, aerobic activity. If they're not able to do because of limitations, maybe knee pain or back pain, they should consult a physiotherapist or an orthopedician to get help. But physical activity is must to increase insulin sensitivity, which I was talking about in the first place. Third is smoking and alcohol or drug abuse. None of the three are found to have any beneficial effect on the body. There was a misconception, not a misconception, the jury was out for many decades that a little amount of alcohol may be good for your heart. But now many studies have come up to debunk the theory. No amount of alcohol is good for anything in your body, including your heart, your brain, your eyes, your diabetes, nothing. They're just extra calories. They're just going to increase the inflammatory milieu of your body, which is going to affect your heart and your brain. So stopping alcohol and stopping smoking is of absolute importance. Okay. And number fourth is coming in contact to health professional when the time is right. One cannot keep on ignoring that my sugars are high. Okay, I will reduce it with only lifestyle changes. I'll not use medicines. That is okay for 3 months, 6 months. You give it a try. If it is still high, you have to go to a doctor. You have to get yourself prescribed medication and adhere to it. People who adhere to diabetic medications go on for 25 to 30 years without any complications of heart failure or eye disease or kidney disease. Thing is stress. Reducing stress by various means. You can work for less hours, look for a change of job, look for a change of site. You can do yoga, meditation to bring down your stress level, increase your contact with your family and friends more, whatever helps you. Right, because stress itself is a trigger for metabolic syndrome and all this high cholesterol and high blood sugar. So stress management is the fifth prong, which we talk about nowadays every day to our patients.
Absolutely. That's the most important thing that, nowadays generation knows, is supposed to know that stress, we should not take that much stress.
Yes.
Right. Perfect. These were all the questions that I had from my end. And I think we have questions from the comments also. Yeah, we do not have questions. In case if anybody of you present here has any question, you can definitely send us and we'll definitely ask, get an answer to you from doctor. Right. Okay. Thank you so much for joining the live session, doctor. This was a great session.
Sure.
I guess, yeah, I am sure that everybody got their answer. Okay, so before ending the live session, I would just like to inform you that at Thip Media, we are dedicated to providing all the health information, and we would request you to not, go and check anything on social media which is unreliable, right? And you can also follow us on follow Thip Media, the Healthy Indian Project, on all our social media platforms. Remember, when you know better, you live better. Thank you so much, doctor.
Thank you so much for having me.
Yeah, thank you. Bye.